Good afternoon, everyone. Thank you so much for being here. Before I start, I wanted to say thank you to the Shippensburg Area School District for having us here today, and more importantly, for hosting this vaccination clinic, along with Henry's Pharmacy from 4 to 7 today. I also want to note that this is the district's 4th COVID-19 vaccine clinic this year. Thank you so much for setting a great example, and thank you to all of the parents and families who came out today to get their kids vaccinated. When it comes to fighting COVID-19, we have made incredible progress, but we still have a long way to go. Fortunately, there is something we can do to protect ourselves and our loved ones. We can get vaccinated. If you have children 5 and older, they can get vaccinated. For teens and adults, they can come in for their first, second, or booster doses today. Here in Shippensburg, we can see what happens when our local leaders encourage their community to get vaccinated and make it easier for families to protect their loved ones. Today, thanks to the school leaders and Henry's Pharmacy, at least 3 dozen more children will get vaccinated, and there are doses available for walk-in appointments. Efforts like these are important because the pediatric vaccine provides comfort for parents, teachers, pediatricians, and community members across the state, knowing that we have a safe and effective way to protect our children from COVID-19 related illness, while also keeping schools safe and open for in-person learning. You are helping us win this fight. Pennsylvanians like you are getting vaccinated. On average, we're seeing nearly 43,000 Pennsylvanians a day step up and get vaccinated. And people are getting a booster dose. In fact, just over 33% of adults in Pennsylvania have gotten their booster dose. But we need everybody to step up. Many people eligible to receive a booster dose still need to receive the extra shot to maximize their protection against the Omicron variant. It is important to note that this virus is evolving, and we need to adapt and follow the science to stay ahead of it. It's no longer sufficient to be fully vaccinated. We need every eligible individual to get your booster dose to maximize protection for yourself and your loved ones. The Department of Health is working to make this easier by collaborating with providers across the state to help ensure that the vaccine and boosters are available in every community. Before I close, I want to thank everyone who has already been vaccinated or took the initiative to schedule vaccinations for their children. You all are being leaders in the fight against COVID-19. Your commitment to health and safety by getting vaccinated and following public health safety guidance is making Pennsylvania a better place to live, work, and play. Thank you. We're now happy to take questions from the media.
I have a question. We got a release today kind of regarding the strike force teams being deployed from federal out to help out hard-hit areas here in the Commonwealth. I was just hoping maybe they can explain a little bit about what that's going to look like for people who want a clearer picture of, how they're going to assist, what they're going to be bringing in, and how that could be a real asset here, especially as hospitals are stretched thin.
Yeah, absolutely. So just to take a step back and look at the big picture, right? As the hospitals are experiencing an increase in the number of inpatients who need care, both from COVID and other things like seasonal flu, kids have RSV, and then there's just delayed care that needs to get made up. We need to ensure that there is capacity within the acute care system, not just to take care of COVID or flu patients, but God forbid somebody have a heart attack or something really urgent. And so the way the department and the administration have been looking at addressing this surge in hospitalizations is to address it holistically. That's why we made a request of the federal government to provide EMS, acute care, and post-acute care strike teams to support the different aspects of the healthcare community. So our request to the federal government is being contemplated. We're working collaboratively with FEMA and HHS to determine what assets they can provide to Pennsylvania, not just to help the hospitals, but to help the entire healthcare continuum.
if you can follow up on that, just kind of what would be like the biggest asset? Like what would be the biggest help right now? Would it be to have extra nurses coming in to assist? Would it be to have, extra testing care, clinics set up? What would really be the most beneficial right now for some of these more hard-hit areas?
So again, we look at it as a system of systems problem, right? So we need to decrease the number of people showing up at the ED. We need to increase the number of people going out of the ED when it's clinically appropriate, and then we need to shore up staffing resources within hospitals and make any extra beds available that are necessary. So it's really about addressing the problem holistically. It's not a simple one-point solution.
Right, I figured it would probably be a multi-tided kind of faceted solution because there's so many different aspects that we're dealing with right now. So do you think, like, I guess, some of the harder hit areas right now have been, Lancaster, Adams County, we've been seeing, some really crazy, like, surges. And I guess the idea is, as you kind of approached it, of some of the things they would be able to help out with. But I guess they were kind of looking for, just how big of an asset would this be? I mean, would having FEMA being able to assist and bring in these teams, these strike force teams, would that be a huge asset? Like, would that really help, these hospitals that are stretched thin? Would it help with bringing in extra doctors, with extra nurses? I think people just don't have a clear idea of what it looks like. And I think that's kind of just what we're trying to, figure out.
Yeah, so we're looking to bring on staffing that can increase capacity by way of the total staffed beds in hospitals, as well as have additional EMS resources and additional capacity in skilled nursing. And so it's really a combination of all of those things in tandem that'll help us to get through the winter.
Are you what you were just talking about, are you talking about in terms of having nurses and EMTs going out to schools or caring for having just more staff everywhere to help with the rising number? And also, can you talk about more about the strike team so that viewers will kind of understand kind of clearly and basically what you mean?
Sure. So we are looking specifically to deploy additional assets to increase capacity in the healthcare community. So that includes EMS, like EMTs, within the hospital and within skilled nursing facilities. We're working collaboratively with the federal government right now to determine what assets, what resources by way of staffing they may have available that we can bring to Pennsylvania that will be most useful and effective in our healthcare community.
And is that because there's a stress on hospital nurses and then so many COVID patients coming in, so you kind of want to add those resources to help take care of these patients with COVID kind of?
Certainly, it's a mix of patients that are showing up at the hospital right now. So certainly there are COVID patients in the hospital that are driving up the overall volume. There's also flu patients. There are patients who are getting traditional necessary care, as well as those who maybe had to delay their care a little bit due to the pandemic previously, and now we're getting caught up on it. So it's really a confluence of a lot of factors the hospitals are dealing with.
Now, there was this report talking about like 200,000 pediatric cases of COVID in the last week. What are you guys looking at in Pennsylvania?
We are seeing an increase in cases overall, including pediatric cases. Right now, there's about 18% of pediatric ICU beds that are available within the Commonwealth. And so certainly that's why we're thrilled to be here in Shippensburg in partnership with Henry's Pharmacy today, vaccinating our kiddos so they can keep learning, growing, and playing safely.
And then just last question, are there certain areas in Pennsylvania, certain counties where you're seeing kind of a reluctance of, parents being reluctant to get the vaccine, that maybe we should, as the media, try to get the message out to those communities?
Certainly. So there's good vaccination data by county that's available on our website. I'm happy to have Barry follow up with you on some of the specific counties that perhaps are a bit lower on the pediatric vaccinations.
But overall, do you think we're doing pretty well?
Well, we certainly need to continue increasing the number of kids that are vaccinated until all kids are vaccinated.
I guess we can just kind of talk a little bit, forget the vaccine,
sorry,
but, I can be loud. So here's a question. We have kids coming back to school, I guess, after this winter break, right? Do we expect things to look a little different? I mean, we saw that the CDC kind of reduced the number of isolation period days for people who are vaccinated or dealing with symptoms or non-symptomatic. As we go into the school year, we have like a mask mandate that's kind of been lifted. Now we're going to start seeing some different different changes in these schools. We have a lot of people coming back from the holidays. Do we expect the numbers, you think, to look better and more promising, or do you think we're going to hit another surge as kind of we get over that hump going into the school year?
So certainly we are encouraging folks who are gathering over the holidays to be vaccinated, to be boosted in advance, and to test in advance of gathering to minimize any type of disruption to kids learning in person. And so that's why we're so glad to be here today at the Shippensburg Vaccine Clinic, where we're excited to see so many kids getting vaccinated so that they can continue to learn and play and grow together. Kelly?
Acting Secretary Klinepeter, thank you. It's always a pleasure to be here with Department of Health. And again, thank you to Shippensburg, the faculty, the staff, the superintendent as well, who we've spent time with for really hosting this vaccine clinic. I can't stress enough what the partnership with the Department of Health has meant with regards to going around to the various schools to promote the importance of vaccine as a strategy, as a part of a comprehensive strategy to make sure that we keep our students in the classroom and continue in person, where the administration and the agencies have continued to say is the best place for our kids as well. And so, again, I just want to emphasize the importance of how we're having events like this and folks are coming out and really showing an interest in the importance that vaccine are going to play in continuing sort of this in-person learning at our schools as well. And so thank you everyone for coming. I'm happy to answer any questions briefly because I think we want to get to the main event, which is the vaccine clinic, and not provide any obstacles for people coming in and out. Perfect. With that, oh, go ahead.
Yeah, we basically gone about the same questions
Sure.
that we were talking to. Like he was talking about kids coming back from school. What are your plans in terms of that, and what are you anticipating?
Sure. You know, and again, most of the guidance that we put together and help provide to our schools is done with the Department of Health. At our conversations that we've been having at schools everywhere, they're preparing themselves to see how these variations, these changes in sort of transmissions are going to affect the instruction of students in our classrooms. We expect for schools now having to make some decisions about how they're going to handle maskings in schools, right? How are they going to adapt any recent changes that are coming down for the CDC with regards to quarantine and isolation as well. So we expect for those conversations to happen at the local level, and they're going to have to put together decisions that continue to keep our students and our families safe as they come for in-person instruction.
I
Right?
think the big question for parents who are going to be watching this, are you going to have more clinics like this? Are you going to have school nurses in there offering vaccines so people know that there are resources more?
Yeah, and just to be very clear, we're going to continue to promote for more vaccine clinics to be held, and we expect, and as we've been seeing in the past couple of months as well, for more of them to begin to emerge. We're also going to keep doing what we can to promote, to make sure that we've got people in place that can create health environments, right? We've been working very strongly to find ways to provide guidance to our schools on how they can leverage federal funds to bring in more school nurses, but also social workers, school psychologists. There are needs that are extensive at our schools that I want to not forget to emphasize, right? The social emotional learning aspects. A lot of the trauma that folks are feeling because of the past 18 months now within the pandemic. And it's not just our students, but our teachers, our leaders as well. And so we want to make sure that those sort of resources are also in place at our schools.
Are there any kind of plans in place now, so you're anticipating what could potentially happen?
Sure. There's resources that we've been releasing for the past year and a half now in terms of resources for helping our schools plan for social and emotional learning, and we're going to continue to build those up as well. And so all these are out there on our website. I wish I had the address here at the top of my head, but we could certainly share it with folks afterwards. It's worth looking at what these resources are.
But do you have like any concrete plans that you can kind of talk about now? Like you guys have talked to nurses and you're hoping in the pipeline to have this done, encourage students, do you have anything really planned?
Nothing that I can share right now that comes to mind specifically, right? But we're certainly, as those things come up, we're pretty public about making sure that we promote them and promulgate them, because I think it's extremely important that we work together with all our agencies to solve those problems.
Now, like we were saying before, I mean, do you think that the realistic possibility, though, as you know, a lot of families have gathered for the holidays, we're seeing an uptick in cases kind of across the board. You know, as schools come back in January after they come out of this winter recess, there's a good possibility, or at least a possibility, that we're going to see a spike inside the classrooms, and that this is going to have to be, you know, contained again. So, I mean, can we kind of maybe anticipate for that? Should teachers plan on that? I mean, as the Department of Education, how do you look at that kind of going forward?
Yeah, you know, and we're very fortunate that we continue to look at this problem in partnership with the Department of Health, right? So I want to make sure that I speak to the things that are important for education. But in terms of your question, we continue to observe the patterns that we've seen the past 18 months. And I think that's the biggest advantage that we have now going into this next wave of the pandemic as well, is that we've known what the importance is of being prepared coming out of a holiday. Right? This is not the first time that we've experienced the Thanksgiving and the Christmas, and so we know what to expect and to brace ourselves. I think as I walked in, there was conversations about what this means when it's coupled with things like flu and other things that are happening as well, right? So these are all these things that we've got knowledge to draw on and begin to prepare ourselves. That's the information as the Department of Education we want to make sure that we emphasize to our school leaders to help them make the decisions, right? I want to emphasize that a lot of the decisions, given what we've seen in the past month going into January around the various mandates and orders in place, these are now becoming local decisions, and folks have to be given the information, and that is our job at the Department of Ed.
Well, I think that you make a good point, because this has now kind of gone back to the schools. I mean, the ability to, you know, whether they're going to have a mask mandate, or they're going to do some kind of distancing, or they're going to do a hybrid program, it's all going to be individual school districts. So I guess the best thing you do is kind of, you know, schools, at least advice to them, you know, school boards, is to kind of look at the situation, look at the county you're in, see what the transmission rate is, and then really just apply the science behind it in that situation, right? So we don't just do things for whether it's political reasons or to make people happy, but really observe it for the health and safety of the kids.
I appreciate that, and I think that's one of the things that I think I'll leave in terms of an anchor. In addition to the patterns that we've seen over the past 18 months, having the science drive a lot of the decision making at the local level is what we continue to advocate for, right? There's a lot of information that we can begin to provide our school leaders to help inform and determine what those thresholds need to be at the local level, right? When they decide to pivot from a mask optional to requiring mask at the schools as well. And so these are all the things that we want to make sure that we continue to work with the Department of Health on to provide folks. I want to thank everyone for coming out today, and we're looking forward to spending some time in the vaccine clinic. So thank you. Appreciate it.
And that's it. Can you tell everybody how easy that was?
I gotta figure out how to give you credit for volunteering.
Yeah.